We've got autonomic reflexes, which involve that smooth cardiac muscle. And again, we're talking about regulating heart rate, respiration, digestion, urination, things like that. There are cranial reflexes associated with the face. So the light reflex that causes your pupil to constrict when a light shined in it, that's a cranial reflex, and that's controlled by a cranial nerve. Again, remember, cranial nerves operate on the same side, whereas peripheral nerves operate on the opposite side. So the right brain controls the right side of the face, but it controls the left side of the body. And here you can see how that works. Now, we don't think of a single nerve or a single axon, going to one specific place. It's a group of axons bundled together is what we think of as a nerve. And that includes sensory nerves and motor nerves. And neuron fibers, or nerves, are bundled together by connective tissue. Now, every single nerve fiber within a nerve has endoneurium, which surrounds each individual nerve cell. And then those are bundled into groups called fascicles, which are surrounded by something called perineurium. And then those fascicles are bundled together with the epineurium, which actually covers the entire nerve. So you can see a spinal nerve, and there's the entire nerve covered with epineurium. And this is a tough, fibrous connective tissue. You can actually, if you were doing a dissection, you could tell when you cut through a nerve because there is some resistance there. So we've got the epineurium, then we've got fascicles, which are surrounded by perineurium, and then we've got axons that go to individual structures. Just another graphic to show you the same thing. So we've got an individual axon surrounded by the myelin sheath that's surrounded by endoneurium. Now, the endoneurium actually electrically isolates each axon so that one axon firing doesn't result in adjacent axons also going off. Now, general classification of nerves, most of them are mixed. That is, they have both sensory and motor fibers. We have sensory fibers, which carry impulses toward the central nervous system. We have motor fibers that carry it away from the central nervous system. And with the exception of some cranial nerves, all of these are mixed. Oops. So, cranial nerves. We've got 12 pairs. Mostly serve the head and the neck, although there is a vagus nerve, which actually extends down into the digestive tract. It extends also to the thoracic area. It helps regulate heart rate. It helps regulate digestion as well. There are just 3 of these that are actually sensory only. So here are the cranial nerves. The olfactory nerve, which is sensory for smell. So it does not have any motor component whatsoever. The optic nerve is sensory for vision. The oculomotor actually moves the eye. It's not sensory for vision. And the trochlear is involved in moving the eye. Now, you don't need to know that cranial nerve 1 is the olfactory and 2 is the optic, but I do expect you to know what the name of the nerve is and what it does. Also, I want you to know which ones are sensory and which one are mixed. So we've already said olfactory is sensory, optic is sensory, and we've got the vestibulocochlear, which is also sensory. We have the trigeminal nerve, which is sensory to the face, and some people can have trigeminal neuralgia, where for whatever reason they get a compression of this nerve and their face can become very sensitive so that even a breeze blowing on it can feel like a burning sensation. It does have some motor fibers as well for chewing. We've got the abducens nerve, which works on a muscle which will allow the eye to turn outward. So if I've got both eyes moving, one is being moved by the abducens muscle. We've got the facial nerve, which is sensory for taste, also motor fibers to the face. We have the vestibulocochlear, which allows us to hear. It also is involved with maintaining our sense of balance. And damage to that area can result in a couple of things. You could have a compression of the vestibular portion of the vestibulocochlear nerve, and you could end up having someone who experiences bad vertigo. You could have damage to the cochlear portion and end up with loss of hearing. We have the glossopharyngeal nerve, which is sensory for taste, and has fibers to the pharynx associated with swallowing. We have the vagus nerve, and that's sensory and motor nerves to the pharynx, the larynx, and the viscera. And the vagus nerve is, well, you can get some feedback on the vagus nerve. See, it goes to the digestive tract. And again, it goes also to the heart. Now, Elvis Presley died because his heart stopped while he was on the toilet straining to use the bathroom. He got kind of a feedback loop that occurred, which impacted the heart. So I guess the takeaway message there is, if you have to really work at it, don't. Now, accessory nerve, that gets fibers of the neck and the upper back, so involved in shrugging and things like that. And the hypoglossal nerve, which gets motor fibers to the tongue. So some common questions that come out of that are, which nerve is associated with the digestive tract and the heart? Which of the cranial nerves is associated with the tongue or the swallowing? And if you see glosso or hypoglossal, that means it's associated with taste, and motor fibers. It's associated with the tongue. So those are a couple of questions, which could be sensory, which are only sensory. Again, we've got olfactory, we've got optic, and we've got vestibulocochlear. Right? I could ask which of the nerves is associated with hearing. So a variety of questions that can be asked about this. I have at times asked as bonus questions for students to list the 12 cranial nerves, not necessarily in order, but just be able to list them all. There are some mnemonics to help you remember the cranial nerves. So there's one that goes on Old Olympus, that's OOO, towering for trochlear, tops, a fine voiced German, viewed, and hopped. So that's one mnemonic. There are some others, like one OOO, I love to touch velvet or something. I don't know. But the one that I grew up with was on Old Olympus, towering tops, a fine voiced German, viewed, and hopped. Now, this table just tells you what the nerves are and the functions that they do. So again, I want you to know the nerve. I want you to know its function. So we'll just skip through that. This graphic Also shows some of the areas that these nerves function on. So olfactory just goes to smell, optic just goes to the eye, oculomotor, trochlear, and abducens also go to the eye. And that's another good question, is which of these nerves does not work with the eye? So we've got 4 here: optic, oculomotor, trochlear, and abducens. I can throw another nerve in there like trigeminal, and in a question like that, then you would need to choose the trigeminal nerve as the one that does not work with the eye. Now, spinal nerves. We've got a pair of spinal nerves between each vertebrae, and they form by a combination of that ventral and dorsal root. They are named for the region in which they arise. So lumbar nerve versus thoracic nerve, and so forth. And here's what we've got, named and numbered by the cord level of their origin. So we have 8 cervical nerves. We have 7 cervical vertebrae, but there are nerves that pass between each of those. So C1 through C8 are the cervical nerves. We have 12 thoracic, and the thoracic nerves, the thorax is defined as any vertebrae that has a rib coming off of it. So we have 12 ribs, we have 12 thoracic vertebrae. We have 5 lumbar, we have 5 sacral, and 1 coccygeal nerve. And for the most part, these are all mixed motor and sensory nerves. Again, the only 3 that are purely sensory are the cranial nerves. So peripheral nervous system, and again, we've got cervical, thoracic, lumbar, sacral, all the way down here. Now, I'm not going to ask you to know what a rami is, but a plexus is where some of the nerve from one vertebrae combines with nerves from the other vertebrae so that we have continuous innervation. If I had a cervical injury, say at C3 or if I had a cervical injury beyond C5, everything that was worked by the cervical plexus would still work. If I had a cervical injury at C2 or C4, I might lose some of my control, but not all of it, because I would have nerves from other vertebrae going to the same area. Okay. And I'm going to stop it here, and we'll pick up on another video.